I happen to have a problem with Kamala trying to correlate the mortality rate of women, the maternal mortality rate, and the abortion ban. The problem with that is that they don't correlate. They really don't. Because the mortality rate has something to do with the health of the mother, prenatal and postnatal care, pre-existing conditions that the mother has. It has nothing to do with a ban on abortion. And race does factor in as well. So when she's trying to make this correlation, it doesn't fit. I were in an intense training course because I was trying to become a doula. And in this training comes the understanding of women's health, the things that the women need to be healthy during the pregnancy. Yes, this book. This is the class I took, okay? From the International Center for Traditional Childbearing. Okay? I took this class to become a full circle doula. There's pre and post natal care. We help the doulas help the women with the entire process, planning out the birth, all that, helping the mother out. Basically, a doula is a birth companion. Okay, this is the Yale Medicine site. It reads, what health conditions are driving the high number of maternal deaths? Chronic health conditions in general have become a contributing factor. Dr. Rainfold explains more women than before are coming into pregnancy with a pre-existing condition. She says that puts them in an increased risk of developing new conditions during pregnancy or worsening existing ones. Heart disease and stroke are leading causes of maternal mortality and cardiomyopathy. A weakened heart muscle is the most common cause of death 1 week to a year after delivery. In addition, hypertension, which affects a growing number of Americans, can lead to preeclampsia, a condition marked by high blood pressure. Proteinuria, sorry if I'm mispronouncing the word, protein in the urine and or signs of liver kidney damage that can develop after 20 weeks of pregnancy. Preeclampsia also poses a higher risk for stroke and other problems after delivery. Another underlying cause of death is mental health conditions. Perhaps surprisingly, both suicide and homicide are considered leading causes of death, both during pregnancy and the postpartum period. If you develop postpartum depression, for instance, it puts you at a higher risk for suicide, Dr. Rainford says. And then number 6, how does prenatal care affect maternal mortality? Early and regular prenatal care improves the chances of a healthy pregnancy. This can start with a visit to the obstetrician before a woman gets pregnant to discuss, among other things, updating immunizations, reviewing medical and genetic histories, and controlling any pre-existing health conditions. A provider will also make recommendations to help ensure the baby will be healthy, such as increasing folic intake. This alone provides a 70% reduction in the risk of neutral tube defects, which include medical conditions such as spina bifida. Okay, this is just some of the things that I would like to put forth. Because Kamala isn't mentioning any of this stuff. She's not talking about any of this stuff. She's trying to associate it with the abortion ban. Okay? As you heard as I was reading, abortion has nothing to do with it. It's all about care. It's all about health care, taking care of oneself. During the pregnancy itself, women often may get unnecessary procedures done. Like, what is that called? For instance, like a C-section. That can actually be avoided if the baby is breached. Like a doula or why am I forgetting her name? A midwife actually knows natural ways to get the baby to turn, to avoid a C-section. It is really annoying when these candidates want to kind of speak on a topic to make it seem like it's really correlated, but it really has. It really doesn't correlate at all. Let's read on. What else can women do to help reduce the risk of maternal death? As soon as a woman knows she is pregnant, she should immediately book an appointment with her doctor or the obstetrician. As soon as a woman knows she is pregnant, she should immediately book an appointment with her doctor or obstetrician practice or clinic where she expects to receive care, obtain confirmation of the pregnancy if necessary, and start following her doctor's advice. Dr. Rainford explains. Sometimes women will need to do research and advocate for themselves to get the support they need. She adds, it's important to have a good therapeutic relationship with your medical provider. She says, women should pay attention to their instincts when they meet a new provider, especially if anything makes them feel uncomfortable. She recommends having a doula, a woman without formal obstetric training whose job is to provide guidance during labor. Doulas are a form of social support. They're knowledgeable and can help with advocacy, she says. Like I was saying earlier on, I was training to do a doula. There was like so much that there was so much that mothers need to learn that they don't know. Because what I was reading through this book, I mean, when I was going through the doula training, I learned so much that I didn't know before. Because one of the reasons why I did that training was to heal from a miscarriage. Okay, I was in a lot of mental pain. I was still trying to heal. And if I knew a doula existed, I probably would have received a doula. There was so much information that a lot of women are missing out on, especially women of color. because we just don't realize some of the stuff that we actually have to deal with, especially when it's just so much. And this has nothing to do with abortion. This has nothing to do with abortion. It has something to do with care. Care doesn't have to be taking a life. Care does not necessarily have to be about using condoms. Oh, goodness. Let's see, moving on. If a woman develops a complication where her pregnancy is already underway, she should not hesitate to ask for a maternal fetal specialist, Dr. Rainford adds. Okay, here goes more. That's on broader change is needed. Dr. Rainford says, while women can play a role, I think it's the responsibility is largely in the hands of institutions to improve the health care they deliver to pregnant women, she says. Black pregnant women, in particular, suffer the worst maternal health disparities, she adds. Even low-risk black women entering pregnancy is significantly more likely to die than a similarly low-risk white woman. Dr. Rainford says, furthermore, high-income non-Hispanic mothers have the worst maternal and infant health outcomes than low-income non-Hispanic white mothers, which suggests a system failure rather than a woman not taking care of her health. Let that soak in there for you. Remember when I told you some racism is involved? There you go. Race is involved. As you can see, this has nothing to do with Trump banning abortions or anything like that. Nothing. Not about contraceptives. None of that. Okay, those things need to change, but that should make women feel as though they can take initiative, she adds. Women can maintain their health and seek out medical care if they feel comfortable with. And they can reach out to family, friends, and anyone else they have available to create a support network, she explains. The people around you can make a difference in success of your pregnancy. For example, a friend or a family member could say, let's go for a walk to get you some exercise, or I'm going to prepare a healthy meal for you. Or they can just ask, how are you doing? Can I help take care of the other children and give you a break? All of those things can help support a woman through pregnancy, she says. Furthermore, I would like to point out that I took this class doing a class in 2013. Okay, Black maternal mortality was an issue long before the overturning of Roe versus Wade, long before Trump ever came into office. So this cannot be blamed on Trump nor any bans or anything else like that. This existed way before then. So that correlation is completely unfounded.